Hi, my name is Alexis Ogdie. I'm Associate Professor of Medicine and Epidemiology at the University of Pennsylvania. Today, I'm going to talk about psoriatic arthritis prevention. So, a couple months ago, I had a patient come to my office who had psoriasis, and he was presenting with dactylitis. So, the interesting part about this patient is that 5 years earlier, I had been referred this patient by the dermatologist who's in my next door to my clinic. And he had said, he has psoriasis, and I think he's having some joint pain. I don't see anything on exam. Can you take a look at him? And at that time, 5 years earlier, he had a little bit of joint pain, like some stiffness in his toes, but really nothing. It wasn't bothering him that much. He was like 28, so he wasn't really interested in following up. I said, let me just see you back in a year. And of course, he died. He disappeared for 5 years. So that 5 years later, when I saw him, he had just developed a dactylitis. And in the interim, actually hadn't had any other symptoms of joint and any other joint symptoms, no other joint swelling or anything. So one of the concepts of PsA prevention is 5 years earlier when I saw him, is there a way that I could have done something differently in order to prevent that onset of dactylitis? So that's some of the work that we've been doing lately is we've been examining what are the risk factors for development of psoriatic arthritis. And if we treat psoriasis, particularly in those patients who are at moderate to high risk for PsA, can we actually prevent the onset of clinically apparent psoriatic arthritis? So first, as far as risk factors, there's been a number of different studies, particularly in the last couple of years, examining the what are the different risk factors for psoriatic arthritis. So some of the ones that we know are obesity. Obesity is pretty strongly associated across a variety of different studies. So it suggests that there really is something there. Number two is trauma. There's been a couple studies that have suggested that. Infection has been seen in a couple of different studies or has popped up in different types of infections. And then psoriasis severity as well. So the more severe psoriasis, the more likely you are to develop inflammatory arthritis. Finally, if you have IBD or uveitis, those are also risk factors. Not so clear whether or not smoking has a role, maybe for some people, maybe not for some other people. So let's say we take some of those independent risk factors like severity of psoriasis, obesity, depression is another one. And if you have a set of those, maybe you get a certain number of points. So that piece is still to be worked out. How many points do you need? What makes up points? How much does each piece contribute? What contributes independently? So that's a lot of where the work is now. But we've come up with kind of a set of those, and we kind of arbitrarily said, let's say you have a couple of these, and we're going to call that high risk. So the PsA trial has just launched. Jose Scher and Chris Richland are the PIs for that particular trial. And in that trial, we're randomizing patients with psoriasis and elevated risk, kind of basically any of those risk factors, and then randomizing them to therapy or no therapy for their psoriasis, and then following them forward in time to see if they develop psoriatic arthritis. Now, we have to have some kind of short-term piece there because development of psoriatic arthritis occurs over the course of 5 years in the case of the patient that I mentioned. So we're using ultrasound in the interim. This is, of course, going to be a first trial. There's probably going to be many trials like this that'll have to happen and kind of advancing each piece. And additionally, longitudinal observational studies like in the Toronto cohort, they're following people over time. So there's still lots to learn here. But I think there's certainly been a lot of movement forward in the last 2 to 3 years, which is really exciting. And I'm looking forward to the results of this trial in the next few years. So stay tuned and look out for additional information coming soon. Thanks so much for your attention.